This is Jeannie Moore. I am a registered nurse for about 34 years, and I am the podcast host for Middle Class Healthcare, teaching the American employee that they could actually get free healthcare benefits from their employers if they knew the right nurses. Today, we're going to be talking to Sotera Delos Santos, who's going to be helping us talk just a little bit more around the treatment of nurses and health professionals. And I'm going to let Sotera introduce herself. Hi,
Hi,
Sotera.
everybody. Hello. My name is Sotera Delos Santos. I am a dedicated nursing leader with over a decade of experience in leading nursing operations here in Southern California. I do have my doctorate in nursing practice, and I have been a leader for almost over a decade and with delivering highest quality of care and standards for patient care services. I am also currently a nurse manager within the Los Angeles County. I am transitioning to a chief nursing officer role in about 2 weeks. I'm pretty excited about that. And thank
Awesome.
you, Jeannie, for the introduction. Thank you.
Yes, you're very welcome. So, we're going to talk a little bit about patient safety. And I'm just going to go ahead and ask you just some real startup questions here. So tell me, how do you feel about the treatment of nurses in 2021 during the COVID-19 crisis? Where were we in the beginning, and where are we at now?
I think during the COVID-19, as it rose during, I believe that was about last year, in the beginning of last year, it was difficult for everybody, especially for leaders like myself. The way we treated nurses and healthcare professionals were generally poor because we weren't prepared. I did not know that tomorrow there's going to be a pandemic, right?
Uh huh.
So, as a hospital system, healthcare system in general, we are unprepared. And the US, United States, is already known to be an acute illness focused system, right? So,
Hmm.
then throw a pandemic on top of that, then we really basically scrambled it into a very poorly managed population. We have a burnt out healthcare professionals, and physically, mentally, emotionally, it was all within that wrong recipe, and it was a
Hmm.
recipe for disaster. So it affected us very badly, and I
Hmm.
think moving forward to today, we have learned so much. We are so much more prepared. We have all the equipments, the vaccine. We have a lot of studies about it, a lot of research that had happened, which very much so elevated our practice on how we are adhering and how are we adapting to the current situation.
Right. So, can you tell us what the current situation is like in the Los Angeles area?
In the Los Angeles area, within our population, we only have about 60% of our population vaccinated.
Uh huh.
And with that, we are still having a rise of cases with the COVID. A lot of the patients that we see currently are not as badly symptomatic. They still
Hmm.
have the symptoms. But unlike before, in the beginning, we were intubating left and right. I work in the emergency room myself during the rise of COVID because,
Hmm.
it was something that I would like to give back to.
Hmm.
And we were seeing a lot of intubated cases. But now, since we are more aware of what the symptoms are, we are better at managing those symptoms to make sure that we can get it under control before we get to the worst part of our health.
Right. So would you say that we're actually treating early symptoms and
Yes, yes,
managing the disease process much
right.
better now that we
Yeah,
have an understanding? Yeah, I
correct.
think so. What we're experiencing today is tremendously different than what we experienced in the very onset
Mhm.
of the disease. I think that it's the most important thing is we are also different demographically based on where we are in the United States,
Mhm.
that the story is different depending on where you
Where you
are
are, right?
living, right? So I noticed that we have a question here on Sigma Theta Tau International Honor Society of Nursing. I had no idea that this existed. So, do you tell me a little bit more about that organization and Is it helping you to accomplish what you want to accomplish?
Yes, so a Sigma Theta Tau International Honor Society is actually by invitation only.
Okay.
So depending on how your grades look like, how your participation in the community has been, then they invite you to be part of that team or
Hmm.
that society of nursing. And
Hmm.
you share ideas among each other, you share your experiences, research, whether that's more experience or evidence based knowledge is more available to us.
Hmm.
Um, and I think in general, as nurses, it is very important to be part of an organization.
Hmm.
That's just because it opens multiple platforms of networking possibilities.
Hmm.
It gives you more knowledge, insight from other clinicians, interdisciplinary perspective in making decisions. Especially for me as a leader, it's really important to have those perspective and making decisions both from most current, what we've learned, most current information, and how the future upholds nursing profession.
Right. One of the things that I have seen nurses do a tremendous amount of is before we start speaking, we say, my perspective is,
Mhm.
and that's really critical because we may be saying two opposite things, but it's our perspective of where we sit in this huge mechanism called healthcare. And so I think that what I am learning is there is a divide, and I'm hoping to eliminate that divide between nurses
Yeah,
because we are the ones who actually protect the patient. And it's
right.
kind of like our unwritten, it's who we are, right?
Responsibility,
And it's
unwritten responsibility.
and
Well,
our
it's part of our
accountability.
code. Yes,
Right.
yes,
It's
our
our
ethics.
unwritten
Yeah,
code. Yes. And
yes,
so
yes. So
I'm really hoping and praying that we are able to share each other's experiences and learn from that because ultimately it's all about protecting the patient. So
right, right.
um I am relatively new to Nurse Deck. I'm so excited about it.
I
Um
know,
and
I
so
know.
can you tell me about what kind of what's happening on Nurse Deck? What is their focus?
So, Nurse Deck is basically the perfect platform for nurses, both novice and experts. So,
Uh-huh.
just like you and I right now, connecting to each other, we are collaborating, sharing our experience, our knowledge, our current. We are not in the same place, right?
Right?
I'm in Southern California, and you are.
In the middle of a cornfield in Iowa.
See, that will just make us closer. Nurse
Right,
Deck
right.
made us closer, connected us together, and that's
Mhm.
what it's basically doing. And really, having this platform today, it just opens up all the possibilities to engage the profession of nursing and
Right,
to grow nursing more than to just the four walls of a healthcare system,
right,
right? So that's why I think right now Nurse Deck is building the profession more by being interactive in both interviewing nurses from
mhm,
anywhere around the US, connecting us, and just making us more network to each other.
right, right. Well, one of the things that I am probably one of my biggest concerns right now is with all of everything that's going on in the world today, we
Mhm.
nurses have a tendency not to take care of ourselves. We learned that
Yes,
very early on. And the
yes,
concern for the amount of stress and potential suicide is great.
right,
And we need to, pardon me, we need to let each other know that you are not alone. And
right, right,
that's the
right,
huge message is we are all in this together.
right,
And please reach out if you're feeling the
right.
effects of that level of stress.
Right, right. And one of the
So,
things that's being a nurse, I think, is you naturally connect,
right,
right?
right,
Once we meet each other, we start talking about experiences, we start talking about what we're looking forward to as nurses, and you're instantly friends. So
right. You're
that's really right. So
yeah.
that's almost like sisterhood or brotherhood. That's
Uh-huh.
already, once you get into that profession, it opens you
Right.
up to all these possibilities. So that
Right.
nurse deck basically does that for us.
Right. The other thing is that when I'm an old lady And when I graduated, the nursing life span was about 10 years before we were burnt out.
Wow.
10 years.
Wow.
And now it's 2. That's unacceptable.
Wow. Wow.
I know that the work and the commitment of nursing school is only we know what that's like. And
Yes. Yep.
to have graduated and then passed boards,
Yep.
uh, you're in a club.
Right.
And so
Right.
yeah, I'm we got to change that to out that 2-year burnout rate. It's
Right, right. And
yeah.
we, I think Nurse Deck is a great platform in informing all our new nurses that, you
Mhm.
know, they're not the only ones going through the struggle of
Right,
learning the profession. We've been there. We've had some very good coping skills, coping mechanisms that we can definitely share with them.
right,
And some evidence that we can share with them, research that we can share with them. So those are the platforms that we can share with the new nurses and also our experts. Maybe they can share more information to us as well.
right. Awesome. So talk about I'm a huge advocate for the quality of healthcare, and I would like all quality metrics to be transparent and put on billboards. And so talk to me a little bit about the quality of healthcare and patient care safety.
Oh,
What does it mean
right.
to you?
Well, it means a lot to me. I have my certification in professional healthcare quality.
Good.
I I got that this year. I was able to achieve that. And really, quality in healthcare and patient care is the foundation of nursing today and tomorrow.
Right.
As we know, we are the biggest workforce in a healthcare system. We account for a third of the operational costs within a healthcare system. So
Uh-huh.
our contributions to quality and patient safety is immense. We are basically
Right.
the driver of the change to advocate for our patients' quality, and we need to own that as the foundation of our profession because we
Mhm.
have the strongest influence as nurses to make the changes needed to ensure that there is the highest quality for our patients and that they are safe when we're
Right.
caring for them.
Right. And I heard a nurse finally be interviewed on a major network, and she said these words. It's our job to question. Nurses
Mhm.
question everything.
Yep.
And I thought, hallelujah.
Hmm. Hmm.
We don't accept anything carte blanche. We
Right.
are the questioners, right?
Right. Right. Right.
It was just so perfect.
Yeah.
So, what are some of the changes that you would love to see in nursing today? I'm getting goosebumps talking to you because
Oh,
this is so cool. I
I
mean,
know.
we nurses are going to take this and run
Yes.
with it. Yeah.
Right, right. So, one of the things that I would like to see more of, which had improved over the years, is the increased awareness that our nursing is bigger than what we think it is. We
Yes.
have a lot of responsibility, a lot of influence. Other than
Hmm.
bedside, of course, bedside
Right.
is our foundation. It is our experience, our knowledge, our aspiration, and where we have been educated. That's
Hmm.
our foundation, the bedside. From
Right.
that, we can only change the country and the world. I
Right.
mean, how that responsibility, right? They say
Mhm.
the more power, the more responsibility you have. And as leaders in healthcare, because we are the biggest workforce, we need to
Yep.
start influencing that more and more as we go through today and tomorrow.
Right.
So really, that's there has been an increased awareness, but I think we can do more of those awareness by
I think
raising our voice.
right. And I think that we are seeing, I think that COVID has been kind of an impetus to finding our voice.
Yes.
Regardless of what you view about COVID, if you're on this side or that side, the
Yeah.
reality is that it's given us a voice to say no more.
Right.
We're
Right.
done.
Right.
And I call it a silent strike.
Yes.
We nurses are just saying enough of this
Right.
craziness. We're just going to take care of our patients and go home, you know.
Yes.
So
Yes. Yeah. Yeah.
it's
And
really
that
fun.
that has built resilience in all of us,
Uh-huh.
and knowing that we are stronger than we ought to be.
Right.
So the more that we become aware, the more that we have evidence, the more that we do our research and we
Mhm.
actually stick together and unite as nurses, then the bigger we are going to become.
Right. One of the things that I have seen, and I'm kind of going off script here, but I was just on another call with another group of nurses that are forming a group to transform healthcare. And I said, "Are you guys seeing all of the viewpoints that are being censored?"
Mhm.
And she said, the gal said, "I didn't know that physicians were being censored," and they are. So
Mhm.
it's like
Mhm.
we kind of have to dig deep and get off of the main track to look
Right.
to look over here. And I think that nurses have a tendency to do that anyway. Why? Because we question everything.
Yeah, right, 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 right. And
And
that
so
comes with experience, with
right,
skills, questioning and advocating for our patients,
right,
because we are the ones that are there 24/7. So we
right,
really have to be able to speak up and say, wait, is this the right way to do things? I mean,
right,
because we are the ones that are there 24/7. We need to advocate for the quality and the safety of our patients. So
right.
we have the right. I think we have been given the right to do that questioning.
Right, that's right. We have been, well, we're taking the right.
Right, right.
Yeah. So talk to me a little bit. I know that are we on Lambda? But talk a little bit about the Delta variant. I know that we touched earlier that this is what we're seeing today is
Mhm.
quite different from what because we know more, right? So tell me what's going on with the Delta variant.
I With the Delta variant, we are seeing the increase in infection rates, right? We are
Mhm.
seeing infection rates, but at the same time, we have more people population wise that are vaccinated. So
Mhm.
whether that variant had infected the vaccinated people, then their symptoms are less. We're
Right.
seeing less hospitalization, less death, and
Mhm.
that less mortality from the variant, which really encourages everyone to, hey, this is when we need to see how prepared we have been, how
Mhm.
much we came from point A of having the rise, and now we're in different variants and we are much prepared.
Mhm.
We have available vaccines, and
Mhm.
we know that we know how to prevent the spread. So
Right.
I think those simple steps, it sounds very simple for many, right? But
Mhm.
we got over smallpox and those all other MMR, that we get our vaccines for while we're young. I
Right.
mean, that means we know more and we're able to do more for ourselves and for our community, which
Right.
really helps us to just be more aware and spread the knowledge and spread that awareness to many, that we can prevent this variant from taking
Mhm.
over us like what the first surge did.
Right, right. And I think that the treatment protocols. So let's talk about the critical care treatment protocols that
Mhm.
we have now versus before. So once a patient presents with COVID-19, whether it's the
Mhm.
Delta variant or not, we
Mhm.
know what steps to take to lessen the exacerbation of the disease. If
Right, right.
I don't know how to say
And
that in layman terms, but
right,
we know how to keep it at bay so that
right.
it's maintainable.
Right. And a lot of these patients that do check in and because they're positive, they're having symptoms, we're able to actually say, these are the steps and go ahead and take care of yourself at home. Right.
Right.
I mean,
Right.
they're stable enough to the fact that, okay, you just need to watch these couple of steps and making sure that you are checking yourself, caring for yourself,
Self.
and being independent in caring for yourself. I think that is putting healthcare to the next level, because now we are
Right.
teaching them to be independent, to watch their symptoms, and to
Hmm.
advocate that if they are not able to manage it themselves, then yes, come back again. But at this
Right.
point in time, you are able to manage those symptoms at home. compared to in the beginning. Okay, we admit, and the we all know mortality increases as you stay in the hospital.
Right.
So now
Right.
we have already diverted that mortality rate into, okay, you can manage this at home.
Well, we used to have a joke, nursing joke, that the very last place you want to be if you're sick is in a hospital, you
Yes,
know?
it still
So
stands true.
it still stands true. So I think that what we're taking back is our ability to educate our patients,
Yes.
which
Yep.
is something that I saw get stripped away when I was a young nurse. I no
Mm-hmm.
longer had the time to educate my cardiac patient about his heart attack, about his diet, about his nutrition, about the medications that we were putting them on. I no longer had the time to give a back rub as pain management. All of that was stripped away because now I had 12 patients instead of 4.
Mm-hmm.
And so
Mm-hmm.
I think that what we're doing is we want our patient education back and we're just taking it.
Yes, yeah, yeah, that's very powerful.
Yeah,
Educating them and knowing more, like what they said, knowledge is power. That that is a great example of knowledge is power.
right, right. I used to work in disease management and talking about behavior change. And
Mm-hmm.
what I learned during that experience, it's not so much about the education that I was providing. The patient changed their behavior when they knew I really cared about them.
Right.
When
Yes.
I finally 2 years down the road and I said, we've been working on all these different issues and smoking is I told you I would never talk to you about smoking, but it's the very last thing that you have to and I care about you and I care
Yep.
about what you're going to do in the next 5 years.
Mm-hmm. Mm-hmm.
And that was the impetus that sincere caring about another human being because you've built that relationship with them.
With them. Yep. Yep.
Yep.
Exactly. And that,
Yep.
I think that as nurses, that comes naturally,
That
is to care for our patients. Yeah.
well, I can't imagine walking into this profession
Mm-hmm.
without that component attached.
Right.
You
Right.
know, um, there's a lot of
Compassion. Yeah.
compassion and caring for other
Mm-hmm.
humans
Mm-hmm.
is kind of part of nursing.
Right.
So
Yes.
I just love this. I love the
I
fact
know, it's
that we are.
exciting. Nurse Deck is putting us all together, and obviously, we all have the same intentions. We all have the same passion and passion for our profession and
Right,
compassion for our patients. So
right,
we all grow on that, and we
yep,
built that together. So that's so
right.
exciting.
It is an exciting time. Well, thank you for so much. I think we can
Thank
wrap
you.
up today, but I look so forward
Thank
to
you.
meeting more nurses. Let's do this. We got it.
Yes. Thank you. Thank you so much, Jean.
All right. Thank you.
Okay. Have a
Okay.
good
Bye
day.
bye. You too. Bye.